Hello everyone, my name is Isha Chitroda from MD3 and today I'm going to be presenting my NIS ORP1. Please bear with me because of some technical issues I'm having with this PowerPoint. So this is our case. So we have a 30-year-old African American woman that presents with resting hand tremor, fatigue, palpitations, insomnia, amenorrhea, unintentional weight loss about 10 pounds. Her heart rate is 70 to 110 beats per minute, and she has exophthalmos. So her salient features are resting tremors, weight loss, amenorrhea, tachycardia because the range is like 70 to 110. I'm sorry, I meant to write 110 over here instead of 100. So it's on like the higher side. So that's some of the salient features, except the exact exophthalmos, thyroid enlargement, fatigue, palpitations, and insomnia. So these symptoms are they're very like broad variety, but they could only mean one thing, and that is, let's get to our diagnosis, which is autoimmune hyperthyroidism, also known as Graves' disease, which is also a hypersensitivity type 2. It's about the antibodies, and I'll tell you guys how it works later. But basically, my other differential diagnoses are thyroiditis, thyroid toxicosis, and Graves' disease. So basically, thyroiditis is inflammation of thyroid, and it can also be just regular hyperthyroidism too. So, what is Graves' disease? So, basically, as I said earlier, that is a hypersensitivity type 2 reaction. And in this, you have autoimmune antibodies attacking your THS receptor on the thyroid follicle. So, keep in mind your TSH levels will be really low because of the repeated stimulation of these antibodies will create large and excess amounts of T3 and T4, so there will be a feedback inhibition, um, which will result in low thyroid stimulating hormones. So that is what you will be able to see in the lab findings here. So you have all the other types of of thyroid diseases: hypothyroidism, Hashimoto's thyroiditis, um, and Graves' disease. So over here, you can tell that the lab findings you will have low or very close to zero TSH. D3 is high and D4 maybe low, but basically they'll be enlarged. And you will see here when you notice that when you compare the antibodies, there will be sometimes they will be normal, but they may be elevated. So this is not a good thing, obviously. So that's what the lab findings will tell you. Finally, we have our treatment. So how are you going to treat this disease? So you have antithyroid drugs and beta blockers. So you can use propylthiouracil, which inhibits the enzyme that creates T3 and T4. Then you have methimazole and propranolol, which is a beta blocker that can help with hyperthyroidism. Um, Then you have, like, it can help with some symptoms like increased heart rate and things like that, which brings T3, and it also brings T3 and T4 to normal. That's what antithyroid drugs do. Then you have radioiodine therapy. This basically destroys overactive thyroid secreting cells. And finally, you'll have thyroidectomy, so just removal of your thyroid, but obviously you will have to give the patients thyroid hormone supplements because they need that to live. So then you have your resources, and thank you very much.